regarding how the Rasavaha Srodhas is getting Dushti, its Lakshana, of course the Nidana, its Chikilsa, and how we can apply those principles in Panduroga. And along with a few points regarding anemia will also be discussed. So let's begin our class. यदन्नं देहधातुओजो बलवर्णादिपोषकं तत्र अग्निर्हेतुराहारात् न हि अपक्वात् रसादयः. This already I have explained while discussing the portion Agni, that is only in the presence of a normal Agni the ahara gets paripakwa or transformed into dhatu, ojas, bala, varna, adi. And if the Agni is improper, what happens? The ahara rasa will not be properly formed, that is, it will be apakwa. And because of that apakwa ahara rasa, what happens is that apakwa rasadis will be formed, that is, the rasa adi dhadus will not be properly formed, or it will be in the state of apakwa. Now this is the cause for rasavaha srodho vikaras. Rasavaha srodho dushti circulates the ama. Apakwa rasadhatu is nothing but ama, and that circulates throughout the srodhas and vitiates the Uttara Dhatus. And Pandu is one among the Rasavaha Srodho Vikara. That is how Rasavaha Srodho Vikara and Pandu is related to each other. Now let's see what is Rasadhatu. It is the first Dhatu, isn't it? Srodhamsi Kalu Parinama Mapatyamanana Dhaduna Abhivahini Bhavanti Ayanartena. This is the definition for Srodhas, and Srodhas is that portion or that channels where the parinama happens. From the ahara, the parinama into dhadus happens in the srodhas, and the first dhatu formed is the rasadhatu. And what is the normal function of rasadhatu? Tushti, Prinanam, Rekta Pushtivistu Rasaha. Why I highlighted Rekta Pushti is because the rasadhatu and the Rekta dhatu goes both hand in hand. Once rasadhatu is vitiated, or if you understand that a rasavaha srodho dushti is happening, indirectly you have to understand that rekta dushti is also coming through. Raktavaha srodhas is also getting affected. And what is the karma of rekta? Jivana, Varna, Prasadana, Mamsa, Poshanai, Rasrik. Why I highlighted Varna is because in our portion, that is Pandu, the normal function of rekta, that is Varna, is not happening. So now, did you understand the relation between Pandu, Rasadhatu and Rektadhatu? All three are both interrelated. Now, the Mula, Rasavaha Srodho Mula. This regarding a Srodhas, you will get a question. Explain the Rasavaha Srodho Dushti Chigilsa. Even if the question is Chigilsa, you have to mention the Mula, Nidana, that is the Karana for Rasava or any Srodho Dushti, its Lakshana plus Chigilsa. So you have to study the Mula of every Srodhas. And regarding Rasavaha Srodhas, the Mula Sthana is Hridayam Moolam Dashacha Damanyaha. All the three acharyas have agreed to the same point, that is, there is no difference in opinion. It is the Hridaya as well as the Dashadhamani. So from that itself we can come to a conclusion that our circulatory system as well as the lymphatic system, any disorders in the circulatory or the cardiovascular diseases or the lymphatic errors, or in all these cases a Rasavaha Srodho Dushti is happening. Now coming to the Nidana or the Dushti Karana of Rasavaha Srodhas. Rasavahini Dushyanti Chindyanam cha Adichindanat. Now along with the Aharaja factors, Acharya has explained the Viharaja factors like Chindyanam cha Adichindanat. Why give importance to this point? Because all the diseases which are currently in the scenario now, everybody is having a stress in some or the other way. So understand that whatever may be the reason, a headache or the loss of hair or premature graying, everywhere stress is one of the reason for all these diseases. Guru, Shida, Adisnikta, Adimatra. Did you get any idea on those points? Yeah, all these Guru Ahara, Shida Ahara, Adisnikta Ahara, these are all indirectly vitiating the Kapha Vardaka factors or these leads to ama, and that is why these all are related to rasavaha, srodho, dushti, karana plus chindyanam chadi chindana. Again chindyanam chadi chindana we can consider it as vada prakopa karana also. So both kapha and vada are involved in the rasavaha, srodho, dushti. Now srodho, dushti, vigara, that is any disturbances in the respective srodhas, that will lead to vigara. Dosha dusha samochana happens and it will lead to vigara, and that srodho dushti vigara is same as the dhatu pradoshaja vigara. That is, if rasa dhatu vigara means rasavaha srodho dushti vigara, Rekta dhatu vigara means rektavaha srodho dushti vigara, because the respective dhadus resides in the same srodhas. Rekta dhatu resides in rektavaha srodhas. Mamsa dhatu resides in mamsavaha srodhas. So the same srodho vigara is the nothing but the respective dhatu pradoshacha vigara. It is substantiated in Charagam Vimanasthana. That is, yanyeva hi dhaduna pradosha vijnanani tanyeva yadasvam pradushthanam dhatu srodhasa. That is the dhatu pradosha vigara. Dhatu pradosha vigara is same as that of the dhatu srodho vigara or the srodho dushti vigara. Both are the same. Now coming to the lakshana of rasavaha srodho dushti. Asraddhascha arujischa asya vairasyam arasajnada hrillaso gauravam tandra sa angamardho jwaratamaha pandutvam srodhasamrodhaha क्लैब्यं सादा कृशांगदा नाशो अग्निर यदा कालम वलयः पलिदानि च. See, astrada, aruji, ase vairasyam, all these you can, all the lakshana you can come to the conclusion that it is because of the excessive intake of guru, shida, adisnikta, adimatra, isn't it? So those kapha vardaka nidana leads to the same dushti lakshana. Hrillasam, Gauravam, Tandra, everything, these are all Ama Lakshana itself, isn't it? Or the vitiated Kapha Lakshana itself. Pandutvam, this is mentioned here, so that is why one of the main vigara in Rasavaha Srodhas is Pandu. Srodhorodha, Klaibyam, Sadam, Krishangada, Nasho Agnir, Agni Nasha is happening. Yadakalam, Valeyaha Palidanicha. See, loss of hair or baldness, premature graying. If you see the reasons for premature graying as well as dandruff and all sorts of hair problems, stress is one of the reason. That is why Acharya has explained Chindyanam cha Adichindanam as one among the Srodho Dushti Nidana, and same it is we can see clinically in the form of Valeha as well as Palidanija. This sloka is very important because even if you forget the Nidana of Pandu, you can write the same Dushti, same Nidana of Rasavaha Srodhas. Now this is the same in a presentable manner of the Samprapti as well as Lakshana of Rasavaha Srodho Vikara, because I told you Rasavaha Srodho Dushti Nidana. What was that? Guru Shida Adisnikta Adimatra Samashnadam Rasavahini Dushyendi Chindyanam Chadi Chindanam, and that will lead to Rasavaha Srodho Dushti. Because of the intake of the Nidana, there happens a Dushti in the Rasavaha Srodhas. So a person in this state, if he indulges in the specific Nidanas of Pandu, like Charamla Lavana Virudatyashana Samashnadam, likewise, then that will manifest in him in the form of Panduroga. Again, a person in the state of Rasavaha Srodho Dushti involves more in Vadadi Prakopa Karanas, along with Shogam, Bhayam, Adilopam, etc., then that will manifest in him as Arojaka, Agninasha, Asya Vairasya. Again, a person in the state of Rasavaha Srodho Dushti gets involved in Krodha, Shoga, Srama, Krita, Sharirushma, Chindyanam, Chadi Chindana, Vega Dharana, then that will lead to Palita Valaya. Again, a person in the state of Rasavaha Srodho Dushti gets involved in more of Tama predominant activities, Vada, Kapha aggravating factors, that leads to Tandra. Now this is how the Rasavaha Srodho Dushti Vikaras is happening respectively. Understood? Okay. Raktavaha Srodho Vidha Lakshana. Now, why did I mention Raktavaha Srodho Vidha Lakshana in Rasavaha Srodhas is nothing but to correlate or to substantiate that Pandu is having Raktavaha Srodho Vidha or Raktavaha Srodhas involved in its Samprapti. The Lakshanas of Raktavaha Srodho Vidha according to Susrutacharya are Shava Angada, Jwaro Daha, Panduda, Shonidaganmanam, Raktanetradacha. So in Pandu there is involvement of Rasavaha Srodhas or Rasadadu as well as Raktadadu also. Okay. Even though Pandu is considered as a Rasavaha Vikara, there is involvement of Raktavaha Srodhas. Now we are entering into our chapter Pandu. So that was only about Rasavaha Srodhas. You will get a question of 15 marks. It was seen in previous question paper. Explain any two rogas with the Nidana Samprapti Lakshana as well as Chikilsa of Rasavaha Srodhas happening due to Sangha. Okay, so one disease already discussed, that was Amavada, and then second disease is Pandu. That is why in Rasavaha Srodhas more importance is given to Pandu as well as Amavada. Both are equally important. You will get either a question of 5 mark for explaining only Rasavaha Srodhas, its details, or you will get in order to explain the Srodhas with respect to any disease. Whatever, even if you get a question regarding Srodhas alone, you cannot explain without giving an example. So study both Pandu as well as Amavada. Moving to Pandu, this is the disease that is explained after Grahani, isn't it? In Charaka, after Grahani, Pandu Roga is explained. Why? Because in Grahani, Acharya has explained the Pitta Prakopa Karanas, and Pandu is a disease where Pitta is predominant, or Pitta Pradhana Vyadhi is Pandu. That is why just after Grahani comes the Pandu Roga. And Pandu is nothing but a disease which is predominant of Pandu Varna, a disease which is named after the Varna that is manifested in the body is Pandu. Its Nirukti is Padi Gadau Dadu plus Ku Pratyam Panduna Nrupado Siddhau. Pandutvena Ubalakshido Rogaha Panduroga according to Madhukosha. That is what I was explaining. A disease which is predominant of the Pandu Varna is nothing but Panduroga. And in Charakam Chikilsa it's explained as Pandu Haridra Haridan Varna. Even though the colors like Haridra and Harida is being mentioned, Pandutva is the predominant or the dominating color among all the other Varnas. And that is why the disease is known as Pandu. And Acharya Susrutacharya substantiates this part like Sarveshu cha edeshu hi Pandu Pavo. What that is Sarveshu cha edeshu. Whatever colors may be present like Haridra, Harida Varna, whatever Varna may be present, Pandu Pavo yado adigo. Pandu Pava will be more adhika or more predominant than all the other Varnas. Khalu Pandurogaha. That is why the disease is called as Panduroga. Susruta Uttarasthana, 44th chapter, 2nd sloka. You can refer. Okay. Pandutva or Pandutvam. That is, it is a mixture of Shveda as well as Pita Varna, according to Amarakosha. And Susruta again says that Shveda Varna is nothing but Pandu Varna. Pandu Pida Sammilita Shukla Kedaki Duli Saniva. That is, it resembles the color of the Kedaki Duli, pollen of Kedaki flowers. This is the Kedaki Pushpa. Same, that is Kedaki Duli Saniva, and Amarakosha says that it is the mixture of Shveda as well as Pida Varna. Shveda Pida Samyukta Pandu Varna Prakirtita. But Susruta and Dalhana opinions that Pandu Shabda is Shveda Varna itself. Moving to the Nidana. Aharaja Nidana as well as Viharaja Nidana. That is just as I told before, a person in the state of Rasavaha Srodhodushti. That is Guru, because of the involvement of intake of Guru Shita Adimatra Aharas, there will be a Rasavaha Srodhodushti in the person, and in that stage, if a person is involving more of Chara, Amla, Lavana, Atyushna, Viruddha, Asatmya Bhojanat, Nishpava, Masha, Pinyaga, Tila Taila Nishevanat, that will lead to Pandu. See, if you see the nidana, aharaja nidana, charam, amlam, lavana, atyushna, all are pitta predominant nidanas, isn't it? All are tikshna in nature. Viruddha asatmya bhojanam, nishpavam, masham, pinyagam, tilatailam, all are pitta vardhaka factors. So that is why Pandu is nothing but a pitta pradhana vyadi. Okay. Again, the Viharaja Nidana involves Vidagda and Avidagda. Again, it is a state of Pitta. Diva Sopnat Vyayamat Maidunasha. Here, Diva Sopna more we take it as a Kapha Vardhaka factor. Vyayamam, Adi Vyayamam, Adi Maidunam. Pradikarma means improper Panchakarma or excessive or improper Panchakarma results. Rudu Vaishamya. Veganam cha vidana. These factors we can take it as Vada Prakopa Karanas. So we can say that in short, Pandu, there is involvement of Pitta dosha, Kapha dosha as well as Vada dosha. All the three doshas are involved, but predominantly Pitta dosha is dominating there. That is why doshaha Pitta pradhanastu kupyanti is explained regarding the Samprapti. We will come to that in the Samprapti. While explaining, Acharya says that doshaha pitta pradhanastu. Why he specifically mentioned that is that this is the reason. Pandu is a pitta pradhana vyadi, but still there is the involvement of kapha as well as vada in it. Again, there is manasika nidanas like kama, chinda. Did you see chinda here? So the same nidana for rasavaha srodhas is one factor, chinda, chindyanam chadi chindana. Again, this is a nidana for Pandu itself. Chinda, fire, krodha, shoga. Then Pandu can occur as a papa karmaja vyadi also. That is just for your understanding only. It's not important for your exam purpose. You just listen. Pandu can occur as a papa karmaja vyadi also. Like any disrespect shown to Deva, Dvija, Dravyahari, Pandurugi, Bhavednaraha, yo Agnistomadi karmani pragamya na samaped. Okay, that was just an extra point. Now, this is what I was explaining previously. Chara, Amla, Lavana, Ushna, Vidahi, Annam, Nishpava, Masha, Tiladaila. All these will aggravate the Pitta dosha in the body. Whereas Adivyayamam, Adimaidunam, Panchakarma, that is Pradikarma, Vaishamya, Rudu Vaishamya, Vegadharanam, Kamachinda, Shoka, Krodha, all are provocating Vada. Whereas the Kapha will be aggravated due to the factors like Diva Sopna as well as Amla, Lavana intake. So that is Pandu is a Pitta predominant Vyadi where there is equal involvement of Vada as well as Kapha dosha. Coming to the Samprapti, Samudirnam yada Pittam Hridaye Samavisthitam. See, Samudirnam yada Pittam. Because of all these factors, Pitta is getting more aggravated. And where is it is first locating? First affecting Hridaye Samavisthitam. Hridaya. What was the moola of Rasavaha Srodhas? Hridayam cha Dashadamaniya. Let's see if Dashadamani are also affected. Vayuna Belino Chiptam Samprapya Damanirdasha. Understood? So Hridaya and the Dashadamani is equally affected in both Rasavaha Srodhas as well as in Pandu. Okay, that is why Pandu is the best example to explain the Rasavaha Srodho Dushti. Okay. So what happens is that because of the Nidana, Pitta gets aggravated and it will be affecting the Hridaya first. Vayuna Belina Chiptam. Because of the strength of the Bela of Vayu, that will be spreaded to the Prabhanna Kevalam Deham, to the whole body through the Dashadamani and gets localized in Tvak Mamsa Antaram Asritam, in between the Tvak and Mamsa. Pradushya Kapha Vada. See, Kapha, Vada, Asrik. Understood the importance of Rekta here? Along with Kapha, Vada, Rekta, Tvak and Mamsa. All these are affected in Pandu, are vitiated in Pandu. Pandu, Haridra, Haridan, Varnan. Either coloration of Pandu or Haridra or Harida Varna is formed in between Tvak, Mamsa, Andhra. Bahuvidham Tvaji. It can be of any colors also. Sa Panduroga Ityuktaha. This is known as Panduroga. Okay, whatever may be the color, Susruta Acharya has explained that Sarveshu Chedeshu hi Pandu Bhavo Yadu Adhika. Pandubhava will be more predominant, and so that roga is Panduroga. Whether it may be Haridravarna or Haridavarna, you term the disease as Pandu. Again, the Samprapti itself, Doshaha Pitta Pradhanastu. Here the Doshaha means all the three dosha itself, but Pitta Pradhanastu. Yasu Kupyandi Dadushu. Because of the dosha vitiation, Dadu will also be vitiated. Shaithilyam Tasya Dadunam Gauravam Chubajayate. What happens to the Dadus is that Shaithilya, Dadu Shaithilya happens. Shaithilya means Durbalada or weakness. And Daduna Gauravam Chubajayate. Gaurava means Kriyasu Asamartya. That is the normal function of Rasadadu as well as the Rektadadu. Rasa and Rekta are the main Dadus involved in Pandu. So here Daduna Gaurava means the normal function of Rasadadu will not be formed. That is Tushti, Pushti, Rekta, Pushti will not be happening. As well as the normal function of Rekta Dadu, that is Varna Prasadana, will not be happening. Instead, what will happen? Rasa and Rekta Dadu will be in a state of Gaurava or Kriya. Gaurava, the explanation given in the commentaries, Kriyasu Asamartya. Tado Varna Bela Sneha. See, because of that, Varna, Bela and Sneha plus Ojo Guna. ये चान्ये अप्योजसो गुणाः व्रजन्ति क्षयम् अत्यर्थम्. Varna Kshaya happens, Bela Kshaya happens, Sneha Kshaya happens, along with Ojo Kshaya happens. Not simply Kshaya, Atyartha Kshaya. Okay, excessively there happens a depletion because of the Dosha Dushya Pradushanat. Understood? Now, why Acharya gave importance to Ojas in the Samprapti is that what is the sthana of Ojas? The sthana of Ojas is nothing but Hridaya as well as Dashadamani. So, that is why in Rasavaha Srodhas, Pandu, direct involvement of Srodha Kshaya, Ojo Kshaya is happening. There is no need for Rasarekta Mamsa Medu Asti Majja Shukravaha Kshaya to happen. That can lead to Ojo Kshaya. Directly Ojo Kshaya is happening in Panduroga. It is because the sthana of Ojas is also Hridaya, and in Pandu also Hridaya and Dashadamani is getting involved. Understood? Now, as a result, so Alpa Rekto, the Rekta will be Alpa, Alpa Medasko, the Medas will be Alpa, Nissara. Nissara means what? Sara is what? Sara is the essence of all Dadus, isn't it? Sara is nothing but Ojo, Ojas. So, Nissaraha. Ojo Guna, since Ojo Guna Kshaya happens, it will lead to the Nissara. Shidilendriya, Shidilendriya, Durbalendriya, Vaivarnya Bhajade. Vaivarnya, the normal Varna is lost. Understood? Again, this is the schematic representation of the Samprapti. Because of the intake of Nidana, Pitta Pradhana Tridoshakopa happens along with Agni Dushti, Agni Vikriti. That is Vidakta Pajaka Pitta plus Dushida Annarasa happens, and both are interrelated also. So what happens together finally is that Hridayam Prapti through the Dashadamani, Pitta Dushida Rasadadu. Through with the help of Vyana Vayu, it will circulate along with Dashadamani, it will circulate Rasavaha, Rektavaha, Srodho Dushti is happening. Dosha Dushya Samurchana happens in the Srodhas, and it will lodge between Tvak and Mamsa, leading to Dadu Shaidilya and Dadu Gaurava, Kshaya of Varna, Bela, Sneha and Ojas. That will finally manifest as Alparekta, Alpameda, Nissara, Shidilendriya, Vaivarnya. And finally, Panduroga is manifested. I hope it is clear by this. Samprapti Kadaga, the dosha is Pritta Pradhana Tridosha Kopa, the Dushyas involved is Rasa, Rekta and Mamsa. Srodhas is Rasavaham, Rektavaham. Srodha Dushti Prakara is Sangha. So any two rogas that where Sangha is happening, or Rasavaha Srodha Vikara where Sangha is happening, one example is Pandu, other example is Amavada. And Adhisthana is, even though Kevalam Shariragatam, it manifests all the body, but predominantly it is in between Tvak Mamsandira. The Ulbhavasthana is Ashya is Amashayotha. Agni is Dhadu Agni Mandyam. With the Vyadi Swabhavam it is Chirakari, and Sadhya Sadhya, either it is in the Nava state it is Sadhya, but as time progresses it becomes Kritsra Sadhya. Moving to the Purva Rupa of Pandu, Tasya Lingam Bhavishyataha, Hridaya Spandanam, Hridaya Spandanam. Hridaya, again importance of Hridaya is coming. because it is the sthana of Rasavaha Srotas, it is the moola of Rasavaha Srotas, as well as in Samprapti, Hridaya is getting affected. So Hridaya Spandanam. Again, if you check on anemic patient, the first symptom they will say is that shortness of breath, even on a little exertion, even on walking a few steps, they will feel shortness of breath or palpitation or dyspnea. Okay, Hridaya Spandanam. Rauksham, Sveda. Rauksham, why is Rauksham? What Varna, Bela, and one more was getting Shaya. What was that? Sneha. So because of Sneha Shaya, Rauksham. Sveda Abhavam, Sramastadaha. Now coming to the Samanya Rupa or the general signs and symptoms of Pandu. Sambhude Asmin Bhavet Sarvakarna Chvedi Tinnitus Hadanalaha Durbalaha. On Bela, Varna and Sneha is getting reduced. So normally the person will be weak. Sadanam, Annadvit, he will have a anorexia or aruji, agnisadam. Everything is related to the Rasavaha Srota Dushti Lakshanas itself. See, while reading the Samanya Rupa of Pandu or the Samanya Lakshana of Pandu, just bring into the mind the Rasavaha Srota Dushti Lakshanas also. Okay. Gatra Shulam, Jwaram, Shwasa Gaurava. Understood? Gaurava, Aruji. Mridideriva Gatrescha, Pididon Mide Madideriva, Shunakshi Kudaha, swelling around the eyes. Haridaha, Shirna Loma, Hadaprapaha, Varna Prafa, Varnakshaya, Hadaprapaha. Kobana, Shishira Dveshi, Nidralu, Stivano, Alpavak, hatred towards cold, excessive sleep. Pindigo Dveshta, that is a calf muscle pain. Khati Uru Pada Ruk Sadananija. In certain forms of anemia, the person will have pain over leg muscles, hip joints, stiffness or the numbness of feet. Okay. Bhavanti Arohana Asa Visheshtascha Asya Vakshyate. Okay. Now, this is the correlation between the Samanya Lakshana of Pandu as well as Rasakshaya Lakshana. As you can see, most of the symptoms resemble each other. Karnakshvedi, Brahmam, Gatra Shulam, Shula again, Shapta Sahatum, Kampam, Shula, Rasakshaya also we can see. Sramam, Hadanala, Sadanam, Shtivanam, Kati Uru, Padaruk, Ruk, pain over these regions. Again, same symptoms we can see in Rasakshaya also. Coming to the Pratyatma Lakshana of Pandu, this is very important. So, Alparekto, Alpamedasko, Nissara, Shidilendriya, Vaivarnya, Bhajate. This is the Pratyatma Lakshana of Pandu. You can get this in Vaiva. Simple line, isn't it? You can easily by heart it. Alparekta, Alpamedas, Nissara. Nissara means Ojokshaya. Okay, Shidilendriya, Durbalendriya, Vaivarnya. Normal Varna is lost. Now, this is again a Vaiva point, how Rektakshaya occurs. See, you know, as I was telling before, what is Pandu? Which dosha predominant? Pitta predominant Vyadi, isn't it? So, you know, Pitta and Rekta are having Asraya relation, or they are having the Eka Yoni. So, naturally, if Pitta is getting Vardaka or Kopa, what should happen to Rekta? Rekta must also be more, isn't it? Rekta Kopa must happen, isn't it? But Pandu, which is a Pitta Kopa or Pitta Pradhana Vyadi, it is actually Alpa Rekta or Rektakshaya is happening. Why? Because you have to understand what happens to Dhatu after Parinama. Any Dhatu after transformation, what will be the two products formed? Sara and Kitta, isn't it? And again this Sara, under the influence of the respective Dhatu Agni, will change into two parts again. What is that? The Stula part as well as the Sukshma part. And the Stula part is for nourishing the same Dhatu. That is the Stula portion of Rasa Dhatu nourishes the Rasa Dhatu itself. But the Sukshma portion is for the next Dhatu, isn't it? The Sukshma portion nourishes the next Dhatu. So, in the case of Rasa Dhatu, the Sukshma portion of the Rasa Dhatu should nourish the Rakta Dhatu, isn't it? But what is happening in Pandu? Is the Rasa Dhatu normal? No. The Rasa Dhatu is not normal. As a result, what happens? Its Sukshma portion for nourishing the Rakta Dhatu will not be there. As the result, Rakta Kshaya is happening. This is explained in the Chakrapani commentary. Go through it. Rakta, Yadyapi Rakta Pittayor Ega Yonitvat. That is, Rakta and Pitta are having the Ega Yoni. Pittenaha Rakta Vriddhir Bhavi. When Pitta should aggravate, Rakta must also be Vriddhi. But that is not happening. Tada Abhi Iha. Iha, here Rakta Kshaya is happening. Why? Because Rakta Poshaka Rasasya Pittena Kshabanat. Because of Pitta, the Rakta Poshaka Rasa is getting Kshabana or reduced. Rakta Poshaka Sara Bhaga Anutpadascha. Because the essence of the Rasa Dhatu, that is the Sukshma portion of the Rasa Dhatu, which should Poshaka or which should nourish the Rakta. That is why Rakta Kshaya is happening. Understood? Now, why Meda Kshaya Alpa Medas is said, isn't it? So, Rakta and Medas are having a relation, that is Stula Astishu Visheshena Majjatu Abhyantarastra. That is, inside the Stula Asti, inside the long bones, Majja is present. And other Idareshu, in all other parts, Sarveshu Sarekta Meda Uchyate. In all the other areas, that Rakta is known as Meda itself. It is explained in Susrutam Sharirasthana, Tridiya Medodharakala. That is the Medodharakala. Medo hi Sarva Pudana Mudarastam Anuvastishucha. That is the Anuvasti, or in all Anuvastis, Medas is the present. You can consider this as a form of marrow itself. So any bone marrow abnormality leads to the erythropoietic, improper, defective erythropoiesis or hemolysis, resulting in Raktakshaya or anemia or Pandu. Now coming to the types of Pandu, Charaka Acharya and Vakpada Acharya has explained 5 types of Pandu, but Susruta Acharya explained only 4. He hasn't mentioned Mrit Bhakshanaja Pandu. Again, this is a Viva point. You will get a question, which is the type of Pandu that Susruta Acharya doesn't mention. It is Mrit Bhakshanajanya Pandu. But the same condition, the same symptoms, Acharya has included in the Sannipadaja type. Okay. And Harida Samhita explains 8 types. Harida Samhita explains 8 types. That is Vada Pitta Kapha Sannipada, Mrit Bhakshanaja, along with Koshtasraya Kamala, Shakasraya Kamala and Halimaga. Harida Acharya considers Kamala as well as Halimaga as a type of Pandu only. He hasn't mentioned it as a separate disease. It is actually a type of Pandu. Panduvadi Roga, according to Harida Acharya, is Kamala and Halimaga, including Kamala and Halimaga. Now coming to the Vishesha Lakshana, this point actually you may not be able to memorize it for your exams, but this portion is important regarding your competitive exams or entrance for the PG entrance question. Say you will get a question like Akshikuda Shrodha is seen in which type of Pandu? It is Mrit Bhakshana Pandu. Just go through each type. From your logic itself, you can come to most of the Lakshanas. Like in Vadaja, it will be Krishna, Karshya Varna is a feature of Vada. So, Krishnada, Panduda, Rukshada, all the features will be included under Vada. Ruja, Todam, Kambam, everything. But coming to the Pitta, all the Pitta predominant features like Daha, Trishna, Murcha, Vidmutra, Pitatva. Likewise, in Kapaja, Kapha predominant Lakshanas like Gauravam, Tandra, Shardi, Shveda, Praseka, etc. And in Tridoshaja, Sannipadaja, all the 3 doshas will be seen in a mixture. You will get all the combined Lakshanas. Okay. Moving to the Upadravas of Pandu. Updravastu Eshu, Aruji, Pipasa, Shardi. See, Aruji, it can be included as one of the Lakshanas of Pandu. Aruji was one of the Lakshana among Rasavaha Srodha Dushti, but Aruji is again a Upadrava also. Okay. Pipasa, Shardi, Jwara, Urdaruja, Agnisada, Shopam. In certain anemia, while discussing anemia, I'll tell you, there occurs a crisis called infarction crisis. In such a stage, because of the infarction, there will be a obstruction to the circulation in the distal areas. So that is why pedal edema, edema of the hands and feet will appear. So Shopa is one of the Upadrava of Pandu. Again, Shuna Akshikuda, was explained in Myth Bhakshrajanya Pandu Lakshana. Okay. Khandagado Abalatva Murchaklama Hridyavapeedanamcha. These are the Ubadravas of Pandu. Now, while I discussed the Rasavaha Srodho Dushti, I don't know if you have noticed, I didn't explain the Chikilsa because we will discuss together with the Pandu Chikilsa. Let's see how it is similar. The Chikilsa is Rasajanam Vikaranam Sarvam Langhanam Aushadam. What is the main Chikilsa? Langhana. Why? Abakva Rasadadu is nothing but Ama. So what is the management of Ama? Langhana. So if you get a question on right how only on the Chikilsa part of Rasavaha Srodho Dushti, you have to write the Ama Chikilsa also. This one line of sloka is not enough. You have to mention the types of Langana, practically how we can give the medicines along with Ama Chikilsa also. Okay. And if you write Pandu Chikilsa along with it, it will be better. Now, is Rasavaha Srodho Dushti Chikilsa and Pandu Chikilsa same? Of course, they are same because Langana is of two types, isn't it? Shodhana and Shamana. And in Pandu Chikilsa, Tikshna Shodhana is explained along with Shamana Chikilsa. So, Rasavaha Srodho Dushti Chikilsa is same as, or the Langana Chikilsa is applied in Pandu Chikilsa also. Now, this is the Chikilsa. We are entering into the Chikilsa of Pandu. Tatra Pandu Amai Snikta Tikshner Urdu Anilomike. This is the Chikilsa Sutra. All the Chikilsa Sutra of the diseases you have to by heart. All the other area you can give explanation, but the Chikilsa Sutra you by heart the sloka itself. Okay. Tatra Pandu Amai, the person of suffering from Pandu, make him Snikta. After Snehana, give him Tikshna Shodhana. Tikshna Urdu Anilomike. Both Vamana as well as Virejana. Tikshna Shodhana. Why? Because there is more of Pitta in him. There is more of Kapha dosha in him. Isn't it? Abakva Rasadadu is Ama. Agni-mandya is happening. So, a normal simple Virejana or Vamana is not enough. Using Tikshna medicines itself, we have to give the Shodhana, provided you have to consider the bela of the patient. Harecha doshan bahusho alpamatran Shvedi dosheshu adinirhadeshu. This is the same concept again in Susrutacharyan. You have to give Shodhana bahusho in excessive manner or alpamatran according to the dosha as well as the condition of the person. Snehidam vamayed tikshnahi. After snehana, give him tikshna vamana. Punasniktam. After vamana, again make him snikta. Punasniktam cha shodayet. Again give shodhana, virejana. After that, payasa mutra yuktena bahushaha kevalenava. When there is a long kevalavada present, when amatva is removed, give him gomutra bhavida milk. Now, in Sadhyaja Panduraga Roga, almost all the Acharyas has explained the Shodhana procedures. These are the references, you can go through it. Snehanam, Tikshna Shodhanam in the form of Vamana and Virejana has been explained. And all the medicines for Vamana and Virejana has also been explained. For the Snehana purposes, mainly 5 kritas has been explained. Panchagavya krita, Mahatikta krita, Kalyanaka krita, Aharagwadadi krita, Dadimadi krita. This Dadimadi krita was a favorite question for the examiners for Viva. So if possible, try to by heart the slokas of Dadimadi krita. Okay. Using any of the kritas, you can do the Snehana. After Snehana, do the Vamana. Vamana with Yashtimadu or small quantity of Madana Yoga. Tada Abhi, according to Susruta Acharya, Acharya has explained that Rudu Desha Prakriti Kala Sharira Abhekshya Mrudu Vamanam Deyed. Not all persons will be able to withstand the Tikshna Vamana. See, there will be Belakshaya for the Pandu patient, isn't it? Varna, Belak, Snehashaya will be there. That is why, since Snehashaya is happening in the Samprapti, we are giving Shodhana prior to, we are giving Snehana before the Shodhana. Okay, that is the importance of Snehana there. But not all persons will be able to withstand the Tikshna Shodhana. That is why, considering the Ritu, Desha, Prakriti, Kala, Sharira, Okay, considering the Agni, considering the dosha, Mridu Vamana can also be adopted. That is the yukti of the physician. Virejana Tatra Pandu Ammai. Again after Snigdha Tikshna Urdhva Anulomakihi. Using Shira or Shira plus Gomutra, Swarna Shiri, Trivrit, Shyama Bhadradharu, Mahaushadha and Gomutra. These are the Virejana Aushadhis that can be selected for Shodhana. Again, Trivrit Churna with Sharkara. Based on the condition, any of the following medicines can be used for Virejana purpose. Coming to the Mrit Bhakshnajanya Pandu. Mrit Bhakshnajanya Pandu, there are 3 types of Mrit, isn't it? Kashayam, because of the intake of Kashaya, Vada dosha will aggravate, Ushara Mrit, Pitta dosha will aggravate, Madura Mrit, Kapha will aggravate. And that will cause the Rukshada, not only Rukshada, excessive Rukshada in the Srodhas, leading to Mrit Bhakshnajanya Pandu. And there Tikshna Shodhana is advised. Why? Because Rasavaha Srodho Avarodha is happening. Srodharodha is happening. And the Raktadadu formed will be, Raktadadu formation will also be impaired. So there is no Raktadadu formed there. In such a condition, the main aim of the treatment is to relieve the Srodharodha. That is why Tikshna Shodhana is administered in the form of Tikshna Virejana. Now, Shodhana is done to achieve the main 2 objectives. One is for the Koshta Shuddhi. There is predominance of Amatva Kapha dosha as well as predominance of Pitta dosha. In order to achieve the Koshta Shuddhi, Srodho Shuddhi, Shodhana is advised, as well as to combat the Dosha Bahulyata. That is mainly Pitta, Kapha and Vada. Vamana is for Kaphaja Pandu, Virejana is for Pittaja as well as Mrit Bhakshanaja Pandu. Samana. After the Shodhana, Acharya has advised Tulihyat, to lick Patya, Abhaya with Madhu Krida. With honey and Krida, Acharya has advised to lick Patya. Again, Patya is an Anulomana, isn't it? So, if there is some doshas that is persisting in the body, in order to get rid of that also, Acharya has advised to select Patya, Abhaya, okay, as a Shamana. Mutre Stidamba, Saptaham Payasa Ayorajo. Pibet, Jirne, Shirena Punchida, Resdena Madhurina. This is another yoga explained in Ashtanga Hridaya. That is Ayorajaha, iron fillings that have been soaked in Gomutra for 7 days. It is filtered and the clear portion is drinked with milk. And once it is Jirna, once it is digested, Acharya has advised to take Rasena, that is Mamsarasa, as well as Madhura drugs along with milk. Why? Shira is advised because it is to restore the bela of the person. Vadige Sneha Vishtam. In Vadika Pandu, Snehana is the main treatment. Paitige Tikta Shidalam. Tikta Shida procedures. Slaishmike Kadu Tiktoshna Bimisram Sannipatik. In Sannivadaja type, all the 3 doshas or the 3 dosha chikilsas can be taken in the combined manner. Now these are some of the Kashaya yogas. Vasha Gudujyadi, Punarnavadi that can be clinically applied in Pandu Yogi. Arishtas like Datri Arishta, Bijak Arishta, Gauda Arishta, Loha Sava can be used to increase the Agni. Churnas like Navayasa Churnam, Vishaladi Churna, Mandura Vadaka. Navayasa Churna and Mandura Vadaka are important for your exam purpose, for your practical exams. So by heart, understand the ingredients as well as the indications. Okay, especially the Navayasa Churna, you have to understand the ingredients. And Lehya like Drakshadi Lehyam, Datri Avaleham can be selected. Now regarding the Pana and Phojana, Mridvigarasa, Amalagarasa, Kaniya Panjamulambu. These 3 are explained in our classics for Pana and Phojana. Regarding the Pathya Apatyas, this is very important. Pathya Apatya alone can be asked for Pandu, not for first year PGs but for final year PGs, final year BMS students. Pathya Apatya of Pandu is very, very important. So if possible, try to study the sloga as such, or else write in this manner. Shali, Yava Goduma, Mutka Yusha, Adagi Yusha, Masura Yusha, Jangala Mamsarasa. See, all these are in a form of Brahmana, isn't it? That is Ojo Vardhana, Bela Vardhana factors. And Abatis, if you know the Nidana, you can write the Apatya itself. From the Nidana itself, there is Tila Taila, Nishpava Masha Pinyaga Tila Daila is explained. So that itself forms the Apatya. In addition to that, Shimbi, Sarshapam, Mritbhakshanam. Mritbhakshanam is the reason for Mritbhakshana Janya Pandu, isn't it? So that is the Apatya there. Patrashaka, leafy vegetables, Ramatam Thambulam, Sura, Raktasrudi, Dhumapanam, Vegadharanam. That is the Viharas. If you know the Nidana, you can directly put it into the Viharaja Apatya. Vegadharanam, Svedanam, Adimaidunam, Divasopnam, Agni Seva, Maruda Seva, Ayasa. Any excessive exertion is the Apatya in Pandu. Now that was about Pandu. Now let's move on to anemia. See, even though we cannot correlate Pandu and anemia together because our Acharyas explained Pandu as a Vyadhi itself. But anemia, as you know, it is only a symptom. So don't try to bring Pandu and anemia together. Even though some Lakshanas of Pandu are seen in anemia, it's entirely two different categories. Okay, so let's start with anemia. The definition says that it is a significant reduction in at least 10% in circulating red cell mass or the hemoglobin content appropriate for the age and sex, leading to the corresponding decrease in oxygen carrying capacity of blood. Don't get worried regarding the lengthy definition. Anemia is nothing but a reduction in the oxygen carrying capacity of blood. And why that happens? Why that reduction happens? It is due to the reduction in the red cell mass or the HB content. And HB content according to the age and sex varies. So based on the age and sex of the person, where there is a reduction in at least 10% in the red cell mass and the hemoglobin content, that indirectly will lead to the reduction in the oxygen carrying capacity of the blood. This is anemia. Now, anemia, around 30% of the population in the world are affected by anemia, especially women and children. In pregnancy, it is a stage where there is excessive demand for, and women are more susceptible to get anemic, and in non-heavy menstrual bleeding. Okay, in such case also they will be susceptible or susceptible to get anemic, and children, because of the malnutrition, they are also a susceptible category for anemia. Now this is the WHO criteria for diagnosing anemia in males. The HB level should be less than 13 gram per deciliter. So what's the normal range in males? It is 13 to 18. And in females, the HB should be less than 12 grams per deciliter. So what's the normal range? It is in between 12 to 17 gram per deciliter. Approximately, accurately saying, it should be, the HB in females must be 11.5 to 16.5. Okay, that's the normal range, and for diagnosing anemia, the HB level must be less than that. Now this is the grading of anemia. There are 4 grading. The grade 1 or the mild category, that is, it should be in between the 9.5 to 11. And grade 2 or the moderate category, it is in between 8 to 9.5 gram per deciliter. This is for both males as well as female, is when the range is between 6.5 to 8 gram per deciliter. And the grade 4 or the life-threatening stage, where the person can go into a shock, is when the HB level is less than 6.5 gram per deciliter. So if you want to study this, you can go study from the reverse manner, that is grade 4 to 1. It will be better to memorize. Less than 6.5, 6.5 to 8 is severe, 8 to 9.5 is moderate, and 9.5 to 11 is mild. Okay, that's about the grading of anemia. Now this is the definition of anemia. It is a Mainly, we can classify the etiology of anemia into three categories. That is, one is the acute significant blood loss in a healthy individual, any trauma or accidents that where a acute significant blood loss is happening, where there is a reduction in the blood cell mass as well as the HP content, the oxygen carrying capacity is reduced, finally anemia. And as I told before you, pregnancy, where there is an increased demand for HP as well as red cells. And dehydration. Dehydration means, how dehydration is a etiology for anemia is that in anemia, the symptoms that are arising is not because of the reduced HP level. What happens due to reduced HP level is that the tissues that need the blood, they will go into a state of what happens if blood supply is not there? What happens to your brain if blood supply is not there? It will go into a state of hypoxia, isn't it? It can go to a state of hypoxia or an infarction. That compensatory mechanisms is actually producing the symptoms in anemia. The same thing is happening in dehydration also. Because of the dehydration, the compensatory mechanisms will lead to anemia. Okay? Clinical features, I told you just as I was telling in the previous slide, the compensatory mechanisms that develop in response to the tissue hypoxia is the main culprit behind the key features, and that is manifesting, the key features are mainly manifesting in the cardiovascular system as well as in the skin. Now, did you note something here? Cardiovascular system, anemia, Pandu, Rasavaha Srodhas, Moolasthana, Pandu Samprapti. Understood how it is getting related? Do I need to explain it? No, the sthana of Rasavaha Srodhas is Hridayam Dashadhamani. The Samprapti involved in Pandu also points to Hridaya, and here in anemia also the compensatory mechanisms are mainly manifested in the cardiovascular system and skin. This is why we try to correlate anemia, Pandu together, but only the clinical features are resembling together. The Samprapti is entirely different in both the cases. Okay. So what happens in cardiovascular system is that the stroke volume, heart rate will be more, palpitation, tachycardia, heart murmur, dyspnea. Palpitation. Do you remember it somewhere else? What was the Purva Rupa of Pandu? Hridaya Spandana, isn't it? So in cardiovascular system also, an anemic person will feel all the symptoms of Panduroga itself, isn't it? Palpitation, tachycardia, heart murmur, dyspnea. Dyspnea means shortness of breath even on walking a few steps, even on climbing two stairs, the person will feel dyspnea or shortness of breath. That suggests that the cardiovascular system is affected. And in skin, generalized pallor of mucous membrane. Now these are the general symptoms. Study these 5 symptoms, because whatever type of anemia you will get a question, whether it may be thalassemia or sickle cell anemia or megaloblastic anemia, you can write, if you study these 5 symptoms, these are the general symptoms in all types of anemia, apart from a few differences. By heart these 5 symptoms. Okay, you can write it for any cases. Headache, shortness of, why headache? I told you tissue hypoxia happens. If it is severe, only then the person will go for a cerebrovascular accident or a shock, or else it can lead to headache, shortness of breath, especially on exercise, palpitation, confusion, weakness and lethargy. All these symptoms are due to mainly the tissue hypoxia. Okay. Now coming to the general signs. Again, these signs are almost seen in all types of anemia. Go through it in detail. Pallor of mucous membrane. The mucous membrane, especially in the lower eyelid and conjunctiva, you can see there is the anterior eyelid as well as the posterior margin. Anterior margin and posterior margin. In between the conjunctiva, you can see the paleness or the pallor in the mucous membrane of lower eyelid and conjunctiva. Examine the patient in the sitting position under good light. Compare with the normal mucous membrane. Confirm the pallor. And the nail bed, coelonychia or the spoon-shaped nails, it's a clinical feature in the iron deficiency anemia. And these atrophic glossitis, it is a key feature in vitamin B12 and folate deficiency. You can see the large red swollen tongue. Okay. And angular stomatitis, you can see that both the angles of the mouth, they are dry, cracked, and on movement of the lips or opening the mouth there will be severe pain along with bleeding also. The patient will be unable to chew the food or smile or talk. It is these two features, atrophic glossitis and angular stomatitis, are the key features in vitamin B12 as well as folate deficiency. Vitamin B12 deficiency anemia is otherwise known as megaloblastic anemia. Now the next symptom is dysphagia. No, next sign is dysphagia. Dysphagia will be usually seen, but very rarely the anemia dysphagia will be due to pharyngeal web. Pharyngeal web, as you can see in the image, it is a collection of mucous membrane in the posterior pharynx. Okay, it's a congenital condition, very rare also. Pharyngeal web if present, then the person will feel dysphagia. But in other words, the dysphagia in anemic patient is due to the dryness of the mouth. Okay, dryness of the throat, that will be a key feature, and because of that the person will have dysphagia. And now peripheral edema, I told you there is a chance for infarction because there will be a condition, I will discuss that. The red cells will become, the normal shape of the red cells is lost, isn't it? The normal shape of red blood cells is a concave shape, isn't it? So that will be lost and they will attain a spherical shape, as seen in spherocytosis anemia. It will be more spherical or it will be more rigid. Once the red cells become rigid, what happens? It will block the small vessels, isn't it? As a result, what happens? There will be infarction, isn't it? There will be infarction, or the circulation will be affected or impaired. And that, if that infarct is in the lower limb, then of course the lower limb circulation is affected. That leads to the peripheral edema in the limbs and feet. High flow murmur, bounding pulse or tachycardia, these are the other symptoms and other signs that you can find in an anemic person. So go through these 7 signs as well as the 5 symptoms. Anemia can be classified etiologically as well as morphologically. Etiologically, again we can classify it into 3 categories. One is due to blood loss. Anemia due to blood loss. I told you in the previous slides that any acute cause where there is significant blood loss, isn't it? So that can be again divided into acute as well as chronic. Acute cause include trauma as well as postpartum bleed. That is not a pre-planned condition, isn't it? So in these 2 cases there will be a reduction, a sudden drop in the red cell count as well as hemoglobin count that will lead to the oxygen carrying capacity of the blood, anemic. In the chronic cases like GIT bleeding, GIT bleeding can occur in the case where there is ulcer, gastric ulcers, hookworm, and in malignancy, NSAIDs, excessive intake of NSAIDs can result in GIT bleeding. That is why NSAIDs usually we are giving in autoimmune disorders, isn't it? So that is why in autoimmune disorder persons, they will eventually have a anemia, not because I'm not saying that everybody will have a GIT bleeding, but excessive intake of NSAIDs, say in RA patients as well as SLEs, they are all autoimmune disorders, isn't it? So immune mediated hemolysis can happen, and as a result they will have anemia. Okay. Excessive menstrual bleeding, and that's understood how anemia can happen. And the second category is the decreased production. That is the decreased production of RBCs. HB level will be low, anemia. And there are 8 causes explained. One is the main deficiency, isn't it? Vitamin B12 deficiency, folic acid deficiency, iron deficiency. These are all, iron is needed needed for the maturation of RBC. And what is folic acid and B12 doing? They are needed for the maturation of the DNA in the RBCs. Folic acid is deficient, they will result in improper maturation of DNA. Again, what happens is that per formation, more production, more working. Okay, so one reason is the deficiency of these three factors: iron, folic acid, and B12. And usage of certain drugs. Drugs are, well, you can include NSAIDs, isn't it? Excessive usage of NSAIDs, like I told before you, they can lead to autoimmune mediated hemolysis. Okay, that will lead to the decreased production. And TNF, tumor necrosing factor. Any malignancy is present, as a result hemolysis happens. Liver failure, renal failure. Okay, that renal failure, liver failure will all lead to low erythropoietin level. Okay, erythropoietin is needed for the synthesis of for the erythropoiesis. So if erythropoietin is less, erythropoiesis will not happen. Okay, hypothyroidism. Then bone marrow infiltration, like in leukemia, myeloma, carcinoma, wherever the bone marrow cancer. What happens? Bone marrow is a site where new RBCs are formed, isn't it? So what happens when the bone marrow is affected in, like in these cases? Automatically new RBCs will not be formed, HB level will be less. Marrow failure, like in aplastic anemia, the bone marrow will be a failure where same process, same pathology is happening. Is it clear? Okay. Now the third category is increased destruction. So anemia can happen due to blood loss, due to the decreased production of HB, or the normally RBCs are produced, HB level is normal, but there is increased destruction or the excessive destruction is happening. What is destruction of RBC called as? Hemolysis, isn't it? So increased hemolysis. Where what all conditions are those where the hemolysis can happen? Genetic disorders. The genetic disorders, again, it is of three categories. That is membrane problems, that is spherocytosis. One example is spherocytosis. Spherocytosis, from this term itself you can understand. The RBCs are getting what shape? Spherical shape, isn't it? So because of that spherical shape, it cannot be able to pass through the small blood vessels. Okay. Then hemoglobin defects, like sickle cell anemia and thalassemia, where there is the defect is happening in the hemoglobin. Enzyme defects, G6PD deficiency. G6PD is glucose 6-phosphate dehydrogenase deficiency. Actually, this is something interesting. Okay, you may not get a question directly on explain G6PD deficient anemia, but just for your understanding, you listen. Okay, you have heard about free radicals, isn't it? So what are they? Are they good to our body? No, they are. Understand that they are something which is harmful to the body. Where do we get the free radicals from? When you're exposed to more oxidative stress, like junk foods, more pollution, when you are in a stage of stress, everything can lead to a production in free radicals in our body. They're the hydrogen ion, okay, they are harmful to the body. But our body has a protector, okay, our body has a protector to absorb these free radicals or the free hydrogen ions and to prevent the harmful effects of the free radicals in our body. Understood? Free radicals are those substances which are, understand in a I'm telling in a simple manner, okay. They are those substances which are harmful to our body. We do not need that. Excessive presence of free radicals will lead to more changes like wrinkling of the skin, premature graying, everything will get disorder, okay. So our body has a protector that will absorb the excessive free radicals to an extent and prevent the harmful causes. And that protector is called glutathione. Glutathione. For glutathione to be formed in our body, it needs a help. Okay? For glutathione to be formed in our body, it needs a help. That is NADPH. Okay? And this NADPH is formed when glucose is converted to pyruvate or phosphate. Okay, and understood, when glucose is converted to pyruvate or phosphate forms, NADP is converted into NADPH. Understood till this now? And for glucose to convert into pyruvate or phosphate, it needs the enzyme G6PD. Now did you understand the importance of G6PD? I'll tell you from the beginning, that is G6PD helps in the conversion of glucose to pyruvate or phosphate, and during this conversion NADP is formed into, or it is converted into, NADPH, and this NADPH supports what? Glutathione. And what is glutathione needed for? It is needed for absorbing the excessive hydrogen ions or free radicals which is harmful to our body. In order to prevent the body from the harmful effects of free radicals, glutathione is needed. So what happens if G6PD is deficient? NADP will not, glucose will not be converted into pyruvate or phosphate. As a result, NADP will not be changed into NADPH. If NADPH is not there, glutathione will be not there. If glutathione is not there, excessive free radicals in the body. And this excessive free radicals, I told you, it can affect the body in a lots of way, and one reason is increased destruction of RBCs. Okay, it will prevent the oxygen carrying capacity of the blood or the hemoglobin. Understood? Now no need to write this much in your exam, but this is the reason happening in G6PD deficient anemia. Understood? Okay. Now these were the genetic reasons for increased destruction, where the treatment is, we can say, there is no treatment for such cases. Okay. And there are acquired disorders. Then SLE and RA. I told you in the SLE and RA, what are they? They are autoimmune disorders, isn't it? So in general, in autoimmune disorders, the person will have an autoimmune mediated hemolysis. Okay, as a result, in these persons, because of that autoimmune mediated hemolysis, the person will be anemic. Okay, and then the drug induced, again you can include the what? NSAIDs itself. Infection like malaria and sepsis. Usually anemic persons will be more susceptible to infection. Their immunity will be very less. So again, malaria and sepsis makes the condition much more worse. And the final condition is splenomegaly. Splenomegaly is called what? It's the graveyard of RBC, isn't it? So when the spleen is very much enlarged, what happens? More and more RBCs will be, healthy RBCs will be destroyed or killed in spleen. This is very important, okay? The classification of anemia. That was the etiological classification. Morphologically, anemia can be classified into three types: microcytic, hypochromic. Microcytic means the cell size, micro, normo, macro. That's the size. Hypochromic means it is the color. Okay. Less color, normal color, megaloblastic. Okay. Now MCV is that mean corpuscular volume. That is the that determines the size of the red cells. That is why in microcytic means the cell size is less, isn't it? So MCV will be less than 80 femiliter. Normal MCV is 90 femiliter. In microcytic it will be very much less than 80 femiliter, and MCH will be less than 27 picogram per liter. Some examples for microcytic hypochromic anemia is in iron deficiency anemia, thalassemia, and sideroblastic anemia. Normocytic normochromic anemia, that is the RBCs are normal only, isn't it? So MCV, MCH will be normal, but normocytic normochromic anemia will be seen in hemolysis in acute cases, okay, and chronic diseases, marrow infiltration, that is bone marrow failure and bone marrow infiltration as in leukemia, carcinoma. Macrocytic megaloblastic anemia, there the MCV will be more than 98 FM. Usually it will be more than 110, okay, or 100. There folate deficiency, B12 deficiency, any liver disease, and also alcohol, hypothyroidism, all these can lead to macrocytic megaloblastic type of anemia where the red blood cells will be larger in size. Okay. Again, acute and chronic anemia, this is already discussed, but still for a better understanding, what's the difference between acute and chronic anemia? Okay, in the acute anemia, the causes is sudden cause, is it a trauma or postpartum bleeding and any acute GI bleeding. Okay, but in chronic cases, it will be a chronic GI bleeding, that is NSAIDs or ulcers or hookworm infestation, NSAIDs, as well as excess menstrual bleeding in pre-pregnant women or non-pregnant women. These are the causes of chronic anemia, and the clinical features are more or less same. The signs and symptoms are more or less same, but still some differences are there. That is, the acute, in the case of acute anemia, the clinical features will be manifesting only when the blood loss is more than 500 ml. Okay, as a result, there can be tachycardia, postural hypotension, confusion, and shock. Whereas in chronic conditions, the clinical features will be mainly depending on the etiology. As a result, there can be tiredness, shortness of breath, rapid heartbeat, sweating. If you check the investigation in both acute and chronic, the HP level will be low. But in the case of acute, if you see the cell study, it will be normocytic normochromic, isn't it? But because it is a sudden cause. But in the chronic cases, it will be microcytic hypochromic anemia. Okay, and the stool occult blood, you have to do 3 samples to confirm that, and you can do endoscopy or colonoscopy to understand the etiology, whether if it is due to any ulcers or hookworm, etc. And in the case of acute, the management should be sudden by fluids or blood transfusion, because there is more than 500 ml of blood loss. So blood transfusion is a first remedy, fluid, IV fluid. And whereas in the case of chronic, you have to correct the etiology first along with iron supplementation. If it is due to vitamin B12 or folate deficiency, give oral folic acid, oral vitamin B12 or IM. Sometimes in the case of chronic ulcer patients, oral supplementation will not be effective. So in such a cases, you have to give it as either IM as well or as IV. Blood transfusion. Now let's see each one. Iron deficiency anemia, or you can say it as IDA. What's the normal total body iron? It is 3 to 5 gram. So a deficiency of less than 3 gram, okay, will lead to this IDA. Okay, in males are less than of 78 nanogram, whereas in a females it should be less than 56 nanogram. Okay, this is the normal value where you have to consider iron deficiency anemia. Okay, the total body iron is 3 to 5 gram. The causes is, as explained previously, it can be due to etiological causes like blood loss, reduced intake of iron. Where do we get iron from? And we get iron from green leafy vegetables, meat, egg, fish, etc. So reduced intake, dietary intake of blood, and pregnancy where there is an increased demand for iron. Malabsorption, iron is absorbed from the small intestine, isn't it? So any intestinal abnormalities that will lead to malabsorption will result in iron deficiency anemia. And again, the blood loss that can occur due to the menstrual blood bleeding, then gastric bleeding, that is GI bleeding, hookworms, ulcers, malignancy. Okay, then coming to the clinical features, koilonychia. As I told before, koilonychia or spoon-shaped nails is a key feature in iron deficiency anemia. Again, angular stomatitis, then glossitis, sore tongue, and also there will be dryness in the throat also. As a result, the person will have dysphagia also. Then gastritis. And Plummer-Vinson syndrome means, I told you, Plummer-Vinson syndrome means it includes the dysphagia. Okay, that is there will be a web in the esophagus that results in dysphagia. If you check the investigation, check for iron, it will be reduced. Then full blood count, ferritin, serum iron, this all will be reduced. And the management is oral supplementation of iron, that is in the form of ferrous sulfate, 3 times daily until the HP becomes normal. But according to the cause, if the cause is due to a gastric ulcer, chronic gastric ulcer, or any due to malabsorption, this oral supplementation will not be enough. In such a case, what should you do? You have to choose for IM or IV. And these are the pictures where there is a normal blood and anemic blood due to IDA. And these are the general symptoms: healthy iron, healthy hemoglobin. You will feel fatigue, sramam, klamam, sadam, tandra. Okay, that was explained in Pandu. And difficulty to focus. And difficulty to focus, confusion, everything will be a symptom. And crazy sore muscles, because iron is needed for the muscles for the normal function. And if iron is less, there will be muscle pain. Okay. Apathy means a form of depression. You will not feel any enthusiasm towards work or family or friends. Always you will be in a state of apathy or a depressed mood. Brittle nails, I told you, koilonaikia or spoon shaped, because iron is needed for the normal or the proper shaping of our teeth and nails. Okay. Then unusually pale skin, it is one of the classical feature. Then pink or red urine, it is because this happens usually in the malabsorption cases. So when the iron is not absorbed in our body, it will be eliminated through the urine or through stool. Now next case is thalassemia. Before you go to thalassemia, you have to understand this. You have already studied in your physiology classes. You know hemoglobin consists of 2 alpha chain as well as 2 beta chain along with iron and heme part. Any abnormality in the production of beta chain or alpha chain, a defective production of beta chain or alpha chain results in thalassemia. As a result, what happens to the red blood cells is that they will be malformed. As you can see in the picture, this is the normal blood cell, whereas in thalassemia there will be defective red blood cells. Now let's see in detail. It is of 2 types mainly: alpha thalassemia, beta thalassemia, because there are 2 chains, isn't it? So when there is a defective production in the alpha chain, it results in alpha thalassemia. When there is a defective production in the beta chain, it results in beta thalassemia. Again, this beta thalassemia is divided into 2 types: beta thalassemia major as well as beta thalassemia minor. Okay. Usually more we get the cases of beta thalassemia major. The other 2 conditions are rare. In alpha thalassemia, there will be less alpha chain and more beta chain production. Okay. In beta thalassemia, it is beta thalassemia major. In both the cases, what is happening is beta chain will be less and more alpha chain. Among the beta thalassemias, beta thalassemia major is more commonly seen. It is otherwise known as Cooley's anemia. And this is a genetic disorder. Okay. Thalassemia is a genetic disorder where both the parents will have the traits of less beta chain production in their blood. And beta thalassemia minor means it is a trait. It is also known as thalassemia trait, where only one parent will be having the abnormality. Okay. Now let's see the symptoms. Beta thalassemia major, it is a commonly inherited homozygous disorder. That is, both the parents are affected. Okay, that is why the sibling will have the child will have beta thalassemia major, and here the defective beta chain production is less, and the clinical features will be severe anemia and failure to thrive, especially during the first 6 months. Even if the child's splenomegaly, increased bone marrow activity, and chipmunk face or Mongolian face, it means the frontal bossing, the frontal part of the head will be bossing, predominant. Growth retardation, because of the growth retardation there will be fracture to the long bones and leg ulcer. He's always susceptible to leg ulcers and congestive cardiac failure. So always he will have a susceptibility to cardiomyopathies, tachypnea, dyspnea. Okay. Now what we can do here is that repeated blood transfusion is needed, and again folic acid deficiency, vitamin B12 deficiency will be there, so give supplements to that in such cases. In since there is a increased bone marrow activity, you have to do bone marrow transplantation also. And final option is gene therapy. Okay, this is the treatment options we can adopt for beta thalassemia major, whereas in the case of alpha thalassemia and beta thalassemia minor, you can say that there is it is more severe, and so actually we can say that there's no much treatment there. Moving to the sickle cell anemia, it is again a genetic disorder where sickling happens, that is the red blood cells attain the shape of a sickle. Here the mutation of gene for HB adults happens. Actually there are two genes, isn't it? HBA and HBS. HBS means it is the gene present in the homozygote, and HBA is for adults, both heterozygotes. Okay. And it is because of the mutation. What's the mutation happening is that there will be a substitution for the valine or glutamic acid at the 6th position of the beta globulin chain. In the beta globulin at the 6th position, there is valine or glutamic acid, and here happens some mutation of the substitution. Okay, that results in the abnormal shape of the red blood cells. Okay, in homozygotes only HBS will be affected. That is called sickle cell disease, whereas in heterozygotes both HBA and HBS will be present. Okay, so let's see the pathology or pathogenesis. Okay, due to any circumstances, when there happens a deoxygenation, what happens to the hemoglobin is that they will undergo a change in shape. Okay, in this condition of patient, in these persons, wherever they are susceptible to a deoxygenation state, their HB will undergo sickling. Okay, but here if immediately oxygenation is given, then it can come to its normal shape. Okay, but usually it won't happen like that. What happens is that sickling change will become permanent. Okay, the normal concave shape will be turned into a sickle shape, and that will become permanent. What happens if that change becomes permanent is that the red cell becomes deformed and more rigid, and because of that rigidity and deformity, small blood vessels will be occluded. It is the concave shape of the RBCs that is helping in the easy movement through the small vessels, but once it becomes rigid, it cannot be flexible enough. It is deformed, isn't it? So as a result, it cannot travel through the small blood vessels, and that leads to the sickle cell crisis. Understood? I was speaking about an infection crisis previously while explaining the symptoms. This is one case, sickle cell crisis. It is because of this, due to the occlusion of small vessels, tissue infarction, and either it can be of either type, tissue infarction or hemolysis, that results in sickle cell crisis, where the person will experience difficulties like hypoxia, dehydration, infection in the form of fever, sudden change in temperature. Suddenly he may feel coldness in his body. Then excessive anxiety, excessive worry, excessive grief, all comes because of this. Okay, understood the pathology happening in sickle cell anemia? Yes, simple, isn't it? I have made it as simple as possible for you to understand. Okay. This is again a more symptoms explained in sickle cell crisis. It is otherwise known as infarction crisis, isn't it? Because of the rigidity in the red blood cells, they occlude the small blood vessels. As a result, what happens to the tissues? Infarction or hypoxia develops, isn't it? And based on where hypoxia is developing, that respective symptoms will be formed. The first symptom is painful crisis. That is, the person will experience intermittent episodes of pain. Okay, tenderness, fever, and inflammation. Why there is intermittent episodes of pain? because there is a occlusion in the blood vessels, isn't it? If that occlusion is in the connective tissue or the musculoskeletal structures, I told you the muscles need iron for its normal functioning. So in iron deficiency anemia, muscle pain is felt, isn't it? Same way, if an infarction is happening in the musculoskeletal structures or in any connective tissues, that will produce severe pain. Tenderness will be there, fever will be there, inflammatory changes will be there. Okay. Then hand-foot syndrome. Hand-foot syndrome is again due to infarction. What happens hand to the hand and the foot? If the blood supply, if the infarct is to the blood supply to the hand and the feet, what will happen? There will be pain or infarction to the digits. As a result, what will happen? There will be blackish discoloration for the digits, purplish discoloration for the digits, dactylitis will happen. Okay, this is the hand-foot syndrome. Very, very, very common in sickle cell conditions because usually the peripheral circulation is affected. Then mesenteric infarction. When the infarction is in the mesentery, what could be the predominant first symptom the person says? Of course, it will be pain in the abdomen, acute abdominal pain. If it is in the brain, cerebral infarction, that will lead to stroke. If it is in the kidney, renal failure, renal necrosis leading to renal failure. And leg ulcers, I told you, it is again because of the infarction in the distal circulation. Leg ulcers, hand-foot syndrome, they goes together. Acute chest syndrome. If the infarction is to the blood supplies to the heart, what happens? Acute chest syndrome arises where the features like chest pain, tachypnea, fever, cough, hypoxia. Bone and joint, ischemia, osteomyelitis. Then sudden pooling of blood in spleen will happen. As a result, there will be what happens in the spleen? Spleen is the graveyard, isn't it? So hemolysis will happen. Acute fall in HP will be there. And cholelithiasis or gallstones, infection of the gallbladder, there it is due to chronic hemolysis, leads to cholelithiasis. These are some of the symptoms that is included under sickle cell crisis or infarction crisis. Now again, this is again clinical features. In general, we can say bone pain, jaundice, pigment, gallstones, leg ulcers, dactylitis. If you do the investigation, electrophoresis, hemoglobin solubility test, the treatment we can give here is supportive therapy. If pain is there to an extent, we can give analgesics, antibiotics, fluids, etc. These are all a supportive therapy, not the actual exact treatment for the disease, because sickle cell anemia is again a defect in the what? Beta globulin. Now the another more commonly seen anemia is vitamin B12 deficiency anemia or the megaloblastic anemia. It is due to the deficiency of vitamin B12, isn't it? Where do we get vitamin B12 from? We get vitamin B12 from egg, meat, leafy vegetables, isn't it? So this is a condition usually seen in vegans, okay, because lack of meat, fish, egg, milk products, they are less in vegans. So usually they are susceptible, but I'm not saying all vegans are susceptible to vitamin B12 of anemia. So the pathology here is that for vitamin B12 to be absorbed in our body, it in your stomach, you know, there are parietal cells. This parietal cells produces intrinsic factor. This intrinsic factor binds with B12 and is absorbed in the ileum. So in certain patients where any abnormality, like in autoimmune conditions also, this abnormality happens. Vitamin B12 will not be binded to intrinsic factor. Okay, something will interfere with them and will prevent the vitamin B12 to be absorbed in our body. Okay, so as a result, vitamin B12 deficiency will happen. Main causes are pernicious anemia, malabsorption, or post-gastrectomy. As a result of post-gastrectomy, majority of the parietal cells will be lost. So naturally, intrinsic factor will be lost. So the clinical features include, you can write the general signs and symptoms along with irritability, memory loss, jaundice, sensory loss, pins and needle feeling in the extremities. If you see the investigation, of course B12 will be less, MCV will be high, platelets will be low, intrinsic factor antibodies will be present. And the management is give vitamin B12 intramuscularly. Okay. Again, folate deficiency, this is also folate deficiency and vitamin B12 deficiency goes together. The one causes include pregnancy, where there is more demand for folic acid. Dietary deficiency, folate antagonist is present in our body also, there will be a deficiency. Clinical features, you can write the previous features like angular stomatitis, glossitis. Okay. Along with that, there will be weight loss, jaundice, GI disturbances. Here the MCV will be high, folic acid level will be low. So the management is give folic acid supplementation. Moving to autoimmune hemolytic anemia, it is because it is of two types, warm and cold type. Okay, and this depends upon the temperature at which the warm antibody acts with the hemoglobin, as well as the cold antibody reacts with the hemoglobin. The warm type, it is associated with the production of antibody like IgG. Usually IgG is known as the warm antibody. They attach to the HB at the body temperature and they are removed earlier by the reticuloendothelial system. But this is the normal procedure, but this can alter in any idiopathic cases when they are precipitated by drugs, autoimmune disorders, leukemia. This will be hampered. As a result, the clinical features will be jaundice, splenomegaly, and the previously explained features. Investigatory findings will be unconjugated hemoglobin will be high, LDH will be high, reticulocytes will also be high. So the management here is give steroids, to an extent splenectomy and vaccination against vaccination. Why? Because sometimes the infections like hepatitis can also result in warm type of hemolytic anemia. Okay, that is why vaccination mentioned. Regarding the cold type, their IgM is known as the cold type of antibody. This will react with the red blood cells and they are also removed by the reticuloendothelial system. It is usually self-limiting, but in certain cases of idiopathic reasons or due to a secondary to infection or lymphoma, this normal procedure will not happen. As a result, what happens is that cold type of hemolytic anemia will be formed. This is known as cold because the condition gets worsened in cold weather. Acrocyanosis or Raynaud's phenomenon, that is the purpling discoloration in the extremities, will be seen. Investigatory findings will be unconjugated hemoglobin will be high, LDH will be high, reticulocytes will be high, and positive direct antiglobulin test. The management include remove the precipitants, that is remove the infection, remove the lymphoma that is causing it, and keep the patient warm and consider immunosuppression also, because this is a autoimmune mediated condition. You can consider immunosuppression also in the treatment of cold type of antibody. So thus I have discussed the major varieties of anemia. I hope it is explained in a simple manner. I hope you can study well after listening to the class. So thank you for your patient listening. Any doubt?